So today I wanted to talk about grafts and how they can look different based on someone's ethnicity, their hair texture, and their thickness. During graft extraction, I see a lot of different grafts, and I don't think people realize how unique everyone's hair follicles and grafts are to themselves. So here we have the most common grafts, which are going to be straight. They're going to come in one to multiple hair grafts. What is really important to pay attention to is how perfect these grafts look. You can see that they're not damaged in any way, and the follicles are intact along with the tissue around intact, which makes them viable and makes the transplant that is going to be successful. So this is the most common type of graft that we see, and it's going to produce results that kind of look like this for patients with straighter hair. You can see here again, and then we get into more ethnic hair grafts, which are going to look completely different. They're going to be more C-shaped and curved underneath the skin, which actually proves to be a little more challenging to extract. Most people that don't have experience doing curly hair or ethnic hair are going to be damaging all of these grafts during extraction because they're super delicate and the angulature is different than the common that I was just showing you. So you can see these grafts are going to be perfect once again. They are all very healthy, they're all intact, and they are all viable. And this is something that's super hard to do with curly hair or ethnic hair because when you're punching the incision underneath the skin, you don't know exactly which way these grafts are going to be going. And when you're extracting, it's even harder. So this is actually the toughest kind of graft that we see, which is called a splayed graft. It's going to go in two different directions, and that's going to be under the skin, which we're not going to be able to see when Dr. Yazdan is punching. So he has to use his skills, his knowledge, his years and years of experience based on doing hair that's like this texture and curly to extract this graft perfectly. And you can see how perfect it is. It's intact. There's no damage to it. And once again, it's going to be a viable graft that we're going to reimplant to yield great results for our patients. And grafts such as so are going to yield results kind of like these, as you can see with these patients. So I hope you guys got a better understanding on different grafts, and make sure you always do your research.